Coronaviruses are a large family of viruses that get their name from the halo of spike proteins on their outer surface, which resemble a crown, the corona under a microscope.
A new respiratory virus called the 2019 novel coronavirus or COVID-19 is making headlines for causing an outbreak of respiratory illness throughout the world.
COVID-19 symptoms.
COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and can recover without hospitalization. For the most common symptoms, it includes fever, dry cough, and tiredness. For the less common symptoms, it includes aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, and a rash on skin or discoloration of fingers or toes. For serious symptoms, it includes difficulty of breathing or shortness of breath, chest pain or pressure, and a loss of speech or movement. Seek immediate attention if you have serious symptoms. People with mild symptoms can recover their symptoms at home. On average, it takes 5 to 6 days from when someone is infected with the virus for symptoms to show. However, it can only take up to 14 days.
COVID-19 causes.
The virus that causes COVID-19 spreads primarily through droplets generated when an infected person coughs, sneezes, or speaks. You can also be infected by touching infected contaminated surface and then touching your eyes, nose, and mouth before washing hands.
The epidemiology.
Globally, over 90 million cases of COVID-19 have been reported. Updated case counts for COVID-19 can be found in World Health Organization and European Center for Disease Prevention and Control websites. The outbreak started in Wuhan, China, in a seafood market that sold live animals. However, as the outbreak progressed, person-to-person spread became the main mode of transmission of COVID-19. Immunocompetent patients tend to feel the symptoms of the virus 6 to 7 days, while those immunocompromised patients tend to feel the symptoms of the virus 2 to 3 days prior to the transmission. The risk of transmission depends on exposure type, like the duration of the exposure, use of preventive measures, and likely individual factors, such as the amount of virus in respiratory secretions. Virus present in contaminated surfaces may be another source of infection if the individual touches it and transfers it to maybe the eyes, the mouth, and the nose. SARS-CoV-2 or COVID-19 is thought to have originally been transmitted to humans from an animal host, but the ongoing risk of transmission through animal contact is uncertain.
Prevention.
To prevent the spread of COVID-19, you should clean your hands often, use soap and water or an alcohol-based hand rub. You should maintain a safe distance from anyone who is coughing or sneezing. You should also wear a mask when physical distancing is not possible. Don't touch your eyes, nose, and mouth.
The treatment.
For the treatment of COVID-19, as we all know, there is currently no cure for the infection with the new coronavirus. However, many treatments and vaccines are currently under study. An individual treatment depends on the patient's health condition and resources available for the healthcare providers. For most people, it can just be treated with rest, drinking fluid, over-the-counter medications for fever and congestion. On the other hand, people who develop serious symptoms needs to be hospitalized for they need to support while their body fights the. Patients who have trouble breathing may be given supplemental oxygen, mechanical ventilation, and in some situation they may need to intubate and oxygenate with conventional ventilation.